A nasal airway provides an effective way to maintain a patent airway in patients with an intact gag reflex. Begin this procedure at the patient's head and examine the nostrils. Select the largest and least deviated or obstructed nostril. Measure the outer diameter of several nasopharyngeal airways against the size of the anterior nostril or the diameter of the patient's little finger. Select an airway that is just smaller than the size of the nostril or the same width as the fingernail of the patient's little finger. Measure the length of an appropriate-sized airway by measuring from the tip of the patient's nose to the earlobe. Hold the airway like a pencil near the flange or at the point at which you wish to stop insertion and lubricate it with a water-soluble jelly. Insert the airway into the selected nostril. Using a gentle back-and-forth rotation, advance the airway gently until the flange comes to rest at the nostril. If there is any resistance felt from an obstruction, never use force. Withdraw the airway, relubricate it, and attempt to insert it through the other nostril. After the airway is fully inserted, the mandible can be released. If the patient gags during the final stages of insertion, the airway may be too long. Instruct the patient to swallow several times to suppress any gagging and withdraw the airway slightly. Secure the airway with tape and check the air exchange to ensure the airway has been properly placed and the airway is patent.